I am Dr. Priyadarshini Mishra, Associate Professor, Abhinav Indra Sports Medicine and Research Institute. I am here to present a paper on title Understanding the Prevalence of Urinary Incontinence, Awareness and Acceptance of Pelvic Floor Rehab as an Effective Management Strategy Among Healthcare Studies in the conference From Gurukul to Global, Paving Pathway to Viksit Bharat at the rate 2047. This paper basically talks about urinary incontinence in young adults or young females. Earlier, it has been explored in geriatric population or elderly population. So we have worked on finding out a prevalence on young population, that is the age from 18 to 25, in healthcare field students of Bhubaneswar studying in the institutes. So what we have done is we had sent a questionnaire which has urinary incontinence scale in that questionnaire involved, and we had sent it to 236 students, out of which we got a response of 102 students, from where we had found out that earlier there are incidence rate of 20 to 30% of prevalence in young females, whereas in our research, when we did the research, we have found the higher rise in the incidence rate to up to 68%. Further, we worked on evaluating how much they are open to speak about the same and what are the management measures what they are taking. Are they approaching a physiotherapist for the care? So when we worked on it, we found that the stress incontinence is more seen in the females than urge incontinence, and they are not aware about the management, that is pelvic floor rehabilitation. Pelvic floor rehabilitation consists of transvaginal stimulation, transrectal stimulation, and interferential therapy, and other various exercises which focuses on pelvic floor muscles. So in conclusion, we found out that the management strategies which are available on our ends, there is a poor awareness among the healthcare students. Why? And the question is why we had chosen the healthcare students, as they are being taught during their course curriculum about these conditions, incontinence, which can be divided, again I'm repeating, which can be divided into stress, urge and mixed variety. It can be physiological and neurological in nature. Physiological in nature is basically seen in females of 18 to 25, which is because of the changes in the sedentary lifestyles and their work culture. So lastly, we want to conclude that if we create an awareness, we can treat these conditions better, in a better way, and we can decrease the percentage of the urinary incontinence and the inconvenience caused to the females. Thank you.
Here in the 4th International Multidisciplinary Conference of Viksit Bharat, I am here to present a topic integrating yogic principles into physiotherapy for rehabilitation and wellness. I am Dr. Moushumi Debnath, Masters in Neurophysiotherapy and a PhD scholar, working as professor in Dr. N.Y. Tasgaonkar College of Physiotherapy, Karjat, which is near Mumbai. First, I would like to define what is physiotherapy. The World Health Organization defines and classifies physiotherapy as an independent profession. Physiotherapists are professionals who can assess, plan and implement rehabilitative programs which improves or restore motor functions, movement ability, relieve pain syndromes, and treat or prevent physical challenges associated with injuries, diseases and other impairments. The main goal in physiotherapy is to reduce pain and restore or maintain an optimal physical functioning. Here we use a wide range of non-pharmacological treatment modalities by including manual therapies, electrophysical agents, thermotherapy, hydrotherapy and graded exercises. On the other hand, yoga is regarded as a holistic approach to health that not only increases flexibility, strength and stamina, but also induces self-awareness, emotional stability and peace of mind. Health professionals are beginning to use yoga as a treatment modality. However, evidence explaining physical therapy, integration of yoga in clinical practice is lacking. Physiotherapy and yoga, though stemming from distinct traditions, it both shares a common goal of restoring function, enhancing mobility and promoting holistic well-being. Physiotherapy relies on evidence based rehabilitation techniques, while yoga focuses on postural alignment, breath regulation, mindfulness, and the integration of body mind awareness. There are a lot of studies which explores the synergistic potential of combining yogic principles with physiotherapy, which leads to enhance the rehabilitation outcomes and also leads to long-term wellness. The key areas of integration of yogic principles or yoga into physiotherapy can be seen where adaptation of asanas are being used to improve flexibility and balance. The use of pranayama or savasana is used for respiratory and autonomic regulations and mindfulness practices to support pain management and emotional strength. Practical applications of yoga integrating into physical therapies includes musculoskeletal recovery, neurological rehabilitation, respiratory therapy, and stress reduction. There are case examples which highlights improved patient engagement, functional recovery, and improved quality of life when yoga-based practices are incorporated into physiotherapy protocols. Of course, there are challenges like safety, cultural acceptance, and clinical validation. When both the interventions are used together, but of course, it underlines the need for individual adaptation and evidence-based practice. Incorporating yogic principles into physiotherapy provides a holistic, patient-focused strategy that considers physical, mental, and spiritual aspects of health, thus establishing it as an encouraging framework for contemporary rehabilitation and preventive health practice. Thank you.
Namaskar. I am Dr. Priyadarshini Mishra from Abhinav Bindra Sports Medicine and Research Institute, Bhubaneswar, Odisha. First and foremost, I congratulate Vedanta on successfully merging various streams on a common platform and take the honor as session chair for Viksit Bharat Conference 2047 with the theme of Gurukul to Global. Session 1 was taken over by Dr. Moushumi Debnath. She presented on a topic integrating yogic principles into physiotherapy for rehabilitation and wellness. The presenter talks about integrating yoga sutras, principles, and holistic balance with evidence-based physiotherapy protocols. It proposes a structured framework, even talks about few researchers advocating same, whereas also identify gaps for clinical implication. This presenter gives light into the fact that yogic practices, principles of yoga, the three basic principles of yoga, can be imbibed into the modern medicine, that is, evidence based practices of physiotherapy. Thank you.
My name is Jignasha N Gohil, Assistant Professor at Vidyadeep Institute of Physiotherapy, affiliated to Vidyadeep University. So today I am presenting a paper entitled From Gurukul to Global Reimagining Physiotherapy Education Through Indic Priorities. So how we link Gurukul values to modern physiotherapy? India's traditional Gurukul system emphasizes personalized learning, close mentorship, holistic health, empathy, and community service. Interestingly, these very principles align closely with the essence of physiotherapy practice today. A physiotherapist is not merely a clinician, we are mentors, motivators, and guides who walk with patients through recovery. The ancient Indic approach to health, rooted in balance, prevention, movement, and mind body harmony, resonates strongly with modern rehabilitation principles. Thus, moving from Gurukul to global is not a shift, but a continuity of India's natural philosophy of healing. What are the identified gaps in physiotherapy education? Limited integration of Indian system of movement and rehabilitation, such as yoga-based therapy, Ayurveda-informed functional recovery principles, and traditional martial arts biomechanics. Insufficient clinical exposure and mentor-student interaction. Dependence on Western frameworks with minimal documentation of India's rich therapeutic heritage. So, addressing these gaps is essential for achieving this vision of Viksit Bharat 2047. Let's see Indic priorities for a future ready physiotherapy ecosystem. First, physiotherapy curriculum must integrate Indic movement sciences like yoga, classical dance biomechanics, pranayama, and traditional posture correction methods. These are evidence supported and culturally rooted tools that enhances neuromuscular rehabilitation and holistic well-being. Second, we must promote a Gurukul like mentorship model within modern institution. Third, India should build research clusters that scientifically evaluate traditional health practices and integrate them with modern physiotherapeutic protocols. This will enable India to contribute original knowledge to global rehabilitation sciences. Fourth, technology like AI based gait analysis, virtual reality rehab, and telephysiotherapy should be used to democratize access, especially in rural India. Fifth, the future physiotherapists must embody Indic values like compassion, discipline, responsibility, and a holistic view of health, not just symptom management. So, what the global vision with Indian roots? By 2047, India can emerge as a global leader in rehabilitation sciences if physiotherapy education integrates ancient wisdom with modern evidence, produces research that is globally respected, and trains clinicians who are both technologically skilled and emotionally grounded. A physiotherapist shaped by Indic priorities is equipped not only to treat disease but to promote lifelong wellness, aligning with the national dream of strong, healthy, productive Viksit Bharat. In conclusion, physiotherapy stands at a powerful intersection of India's healing tradition and modern scientific innovation. If we restructure our education system with Indic priorities, we can create an ecosystem where every physiotherapy student become a healer, researcher, innovator, and ambassador of India's holistic wisdom. Thank you.
Namaskar, I'm Dr. Priyadarshini Mishra, the session chair. Here, the session 2 was presented by Dr. Jignasha Gohil. Topic from Gurukul to Global, Reimagining Physiotherapy Education through Indic Priorities. The presenter effectively outlines three core Gurukul tenets: nature aligned teaching, mind body integration, and experimental learning that aligns with India's NCF 2025 vision for sustainable education. Further, it highlights a framework integrating traditional and ancient practices with evidence based practice to result in better quality of life. This work offers a noble culture but requires refinement from broader applicabilities. Thank you.